Doc, speaking of measures, over the past 4 months, we've been introduced to so many terms, from the most basic to number of infections to number of deaths. We were introduced to R naught. We're now being introduced to positivity rate and so on. What are you looking at? What for you is are the most important metrics right now to give us a real idea on?
I think we really have to concentrate on two things dun sa ating pandemic response. Overall, we have our surveillance, and it informs us kung saan yung lugar, kailan nangyayari ito, at sino yung mga tao na maaring naging affected dito sa COVID. And we have good examples from our different local government units where they have really tried to zero in on not the whole city, but on specific areas like barangays, neighborhoods, even households. So nagko-cross-pollinate tayo with other LGUs to learn from their good practices. Having said that, yung sa surveillance, we also need to firm up our response. Yung response natin is basically very, very straightforward. We identify the cases, find their contacts, try to quarantine those contacts, and for the cases, we put them in quarantine, either at the home or in the quarantine facilities, yung mga temporary treatment and monitoring facilities natin. We have a lot of those, and they are presently underutilized. So kailangan talaga natin magamit sila. And if we need them to be seen at the hospital, we refer these cases, especially mga severe and critical cases. So that's the real way, yan yung parang how we can cope with this pandemic now that we don't have the vaccine yet. We really just have to have those measures in place, and wag tayo parang magpakakampante, not just in our homes or neighborhoods, but pati sa workplaces, mga business establishments, commercial establishments, and ang pinaka-importante ngayon that we really need to monitor yung nangyayari doon sa transportation sector. Kasi yung problem natin doon sa kumpul-kumpulan ng mga tao, pila-pila, kailangan talaga magawa natin ng mabuti ito at talagang mag-iingat ang ating mga kababayan dito sa mga paglabas natin. Ngayon lumalabas na tayo dun sa ECQ to GCQ and then to the modified GCQ. And hopefully, we can make people go back to their work. Although maraming mga workplace arrangements siguro na pwedeng gawin from the home or from the parang may mga social distancing sila dun sa mga establishments sila or workplaces. And I think we're really in a better place now. Kailangan lang natin to see how it goes. Definitely, there will be other LGUs that will be in a parang improved state compared to the others. So kailangan alalay tayo dun sa mga medyo nakaka-catch up pa, especially in those areas in other parts of the countries na nagkakaroon na ng mga kaso na nare-report. Those LGUs or provinces or cities na nakakatanggap na ngayon ng mga returning OFWs and locally stranded individuals. So that's the thing. The surveillance and the response is key to how we will succeed in forming our plan to cope with this pandemic.
What about the projections? We were just talking about it earlier. There's a projection that we might reach 100,000 by the end of August, and maybe even upwards of 60 or 70,000 by the end of this month. How should we take that, given that the government is set on maintaining the quarantine levels at this time?
Yeah, if that were so, we have to really parang try to predict or try to come up with an idea of how that will happen. Kung mangyayari yan, I guess that will happen in our metropolitan area, especially here in Metro Manila, sa National Capital Region, and probably where we've seen it grow, yung mag-evolve in the past weeks dito sa Cebu City. We're hoping that it won't happen in the other bigger cities of the Philippines, pero if that happens, talagang dadami exponentially yung kaso natin. But having said that, kailangan natin maalala na hindi mangyayari ito kung hindi natin makikita muna kung saan siya nang gagaling dun sa level sa local, dun sa mga barangay or neighborhoods. There are a lot of parang initiatives now some of them are using technology, some of them are trying to maximize yung ating RT-PCR to also cover those who are living in the community. I think Secretary Vince Dizon, our Deputy Chief Implementer for the COVID Task Force, alam ko na they have that in the pipeline na magkakaroon tayong testing for the asymptomatics so that we can estimate how we can try to look at yung transmission within the communities. Before kasi we had very limited means to test people, and we only reserve that for patients, those who are symptomatic, the healthcare workers, maybe the frontliners. Now, we have to expand further yung ating mga, kung sino bibigyan natin ng mga tests. The RT-PCR and rapid diagnostic test will have to be complementary to each other. It's still the RT-PCR, yung ating gold standard, but for those who might be undertaking studies in the community, for us public health professionals and colleagues, gusto namin malaman talaga kung ganong kagrabe yung infection or yung prevalence or incidence of COVID-19 virus infections in the community. So kung doon nagmumula, dapat unahan na natin siya. If this were a race, so virus versus people, and I'm putting my my bets on us to be able to organize ourselves so that we can really preempt or maybe try to prevent na mag-escalate ito to that so-called estimate of 100,000